Well, it's time now for our health report, and joining us now is Africa 54 health correspondent Linord Moudou with some news on the workforce and sustainable development goals. Linord.
Well, as the global community ramps up its efforts to attain the Sustainable Development Goals, SDGs 2030, experts say there is a need to invest more in the health workforce, especially in low and middle income countries. The World Health Report 2006 estimated a global shortage of 4.3 million health workers. Since then, a lot has been done and some countries have seen some improvements. One SDG sub-target 3C aims, quote, to increase substantially the recruitment, development, training, and retention of the health workforce. However, medical observers say many challenges remain. They say the quantity, skills, and geographic distribution of the health workforce are key factors that have held back even greater and more equitable progress on global development. For more on the subject, we are joined live via Skype from Boston, Massachusetts, by Dr. Vanessa Kerry, founder and CEO of SEED Global Health, an organization that specializes in building the health workforce in Africa. Dr. Kerry, welcome to the show.
Thank you. It's a pleasure to join you.
It's great to have you. Listen, there are some statistics that show that as of 2015, the African region had an average of 1.30 health workers per 1,000 population, far below the 4.5 per 1,000 required for Sustainable Development Goals. That's quite a big gap right there. What is your reaction?
It's a startling gap because the African continent also has about a quarter of the world's global burden of disease, and they have only 3% of the world's healthcare workforce to address that disease. And what fundamentally is really bothersome to me and the whole team at SEED Global Health is that there are two standards of care in the world. And in 2017, that doesn't need to be the case. And that's what we're really trying to work against.
So where does the process start and where do we see the most pressing need as we try to address this challenge?
So over 90% of the countries in the sub-Saharan African continent have critical shortages of doctors, nurses, and midwives. And we at SEED Global Health really work with local partners, the institutions in the countries where we're working, in order to change that so that there are enough doctors, nurses, and midwives to not only provide outstanding care for the populations and the health needs of a country, but also to ensure that they can train their successors and support the health system as a whole. Our goal is to help really invest in future health leaders who become agents of change and really help demand something different in 2017 and closing this gap to ensure that everybody everywhere has access to the same quality of care.
We hear a lot about health system strengthening, which is very, very critical, but there seems to be an emphasis on infrastructure. So what did outbreaks like Ebola and Zika taught us in terms of the importance of the workforce?
Absolutely. There has been, to your point, investment in infrastructure and, providing medicines, and all of those are critically important. But you need people to walk the halls of hospitals and clinics, and you need people to deliver medications and to follow patients on it. But you also need people to understand the complexity of disease and what is happening with it. So Ebola happened at the scope and scale that it happened in West Africa because there weren't enough healthcare professionals to help sound the alarm, mount the response, and build the strategy to stop Ebola in its tracks. And one of the great lessons that I think has been learned is the need for that kind of sort of healthcare provider to be able to really help protect a country. It's a global health security issue at this point. And as we go into the UN, next week, and really look into Sustainable Development Goals, I believe that healthcare providers have to be, and healthcare professionals have to be top of the list.
Okay, Dr. Kerry, we have to leave it there. Thank you so much for joining us today.
Thank you for having me.